Hi everyone, welcome back to my YouTube channel. Today we are going to talk about frontal bone, and here at the side you can see the diagrammatic representation of skull showing highlighted green area that is frontal bone. Let's start our topic with introduction. Frontal bone is a large singular bone at the front of skull. It forms the forehead, it forms a part of cranial roof, and it also forms the superior walls of orbits. It also participates in formation of anterior cranial fossa that house the frontal lobes of brain. Now let's talk about anatomical features of frontal bone. It has squamous part, that is vertical portion, orbital part, that is horizontal portion, and nasal part. Now let's talk about these portions or anatomical regions one by one. First we have is squamous part or vertical portion of frontal bone. It forms the forehead. It is marked by two smooth elevations that are called frontal eminences that are more prominent in children. They include the glabella, that is a smooth, slightly depressed area between the eyebrows. It contains the supraorbital margin with supraorbital foramen or notch, through which nerves and vessels pass to the forehead. Next anatomical region of frontal bone is orbital part or horizontal portion. It forms the roof of the orbit. It divided into two orbital plates separated by a gap called the ethmoidal notch. The notch accommodates the ethmoid bone and contains small pits for ethmoidal ear cells. Next anatomical region of frontal bone is nasal part that projects downward between the eyebrows. It articulates with the nasal bone, maxilla, and nasal cartilage. It contains a nasal spine which contributes to the nasal septum. Now let's talk about frontal sinuses. They are located just behind the superciliary arches and they are air-filled cavities lined with mucosa in the frontal bone. They are present by age 6 and grow through adolescence. Their function is to lighten the skull, humidify the air, and enhance voice resonance. Open into middle ear meatus of the nasal cavity through the frontonasal duct. Now let's talk about articulations of frontal bone. The frontal bone articulates with 12 bones, and these include cranial bone and facial bone. The frontal bone articulates with the cranial bones that are two parietal bone, one sphenoid bone, and one ethmoid bone. The facial bone that articulate with the frontal bone are two nasal bone, two maxilla, two lacrimal, and two zygomatic bones. The coronal suture marks this articulation with the parietal bone. Next, let's talk about surface landmarks and attachments of frontal bone. They have superciliary arches that are prominent ridges over the orbits. They have temporal line that are arched ridges that mark the attachment of temporalis muscle. They have frontal crest, that is the midline ridge on the internal surface for attachment of pelvis cerebri. Now let's talk about development and ossification. Frontal bone develops from two ossification centers in the embryo, initially separated by metopic suture which usually fuses by age 8. In some adults, the metopic suture persists, partially or fully, known as metopism. Now let's talk about clinical significance of frontal bone. The first significance is frontal sinusitis. There is inflammation of frontal sinuses and that can cause headaches and facial pain. Second clinical significance is fractures. That is, trauma to the frontal bone may lead to orbital roof fracture or damage to the frontal lobe. Next is surgical access. As neurosurgeons sometimes access the brain through the frontal bone through procedures like craniotomy. Now let's talk about the conclusion of this lecture video. From shaping the human face to the housing the frontal lobes and sinuses, frontal bone is as functionally vital as it's structurally prominent. Understanding its anatomy is key in medicine, dentistry, neurology, and forensic sciences. And this was all about frontal bone. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.